Disclaimer, I'm not a medical professional, so if you're thinking about Botox, you should really be in consultation with one. I'm not that. I'm a 47-year-old skin enthusiast who's passionate about skincare and other beauty-related things, and I really just wanted to do this video to be informative and give you some education and also just simply my own opinion. And I also say never. So I'm filming this video at this point in time. I do not want to get Botox, but you never know what future me might decide to do. I mean, if you told me at age 30 that at age 47 I'd be filming YouTube videos on skincare content as well as TikTok and Instagram, I'd have thought it crazy. So let's get into it. What is Botox? Botox is a neuromodulator that in essence really is injected to the face to target the nerves, which in turn target the muscles. And what they do is paralyze those muscles so that they inhibit them from contracting. The contraction of the muscles in your skin is what causes your skin to fold, and the repetitive nature of the muscles contracting and folding is what causes wrinkles in your skin. These types of wrinkles are classified as dynamic wrinkles. So it's important to note that Botox is a preventative treatment. By preventing the muscles to contract, it's really smoothing out the look of your skin because your skin isn't folding in a repetitive nature on the daily. Botox is a brand name, and there are many other neuromodulators. It's a situation where the brand name overgeneralizes to the product and then everyone attributes that product to the brand's name. Must work really well in favor of the brand. It's kind of like Kleenex. This is actually tissue, but everybody overgeneralizes the product to be called Kleenex. At least that's what I call it. Tell me in the comments below, what do you call this? Do you call it tissue or do you call it Kleenex? Kind of wondering if it's a thing by country as well. Back to Botox. Botox is typically injected in the forehead here, in the 11s here, these wrinkles here, which are called what are they called? The bunny wrinkles or something? Oh my gosh, I think that's the cutest word ever. Crow's feet, at least that's what I call them, around the eyes, and laugh lines. But they can also be injected into the neck and jaw as well. Botox can also be used for clinical medical interventions or treatments as well. So things like TMJ, chronic migraines, excessive sweating, muscle spasms, and even MS. Would love to hear from you if you're comfortable sharing any of you that use Botox as a medical treatment for a medical condition. So getting into why I don't get Botox, let's get into the cost and the maintenance. When it comes to the cost, it kind of reminds me of something else. I know you can't compare it on scale, but just hear me out here. It's the cost of gel nails. Now, I am easily influenced by other people who have fabulous looking nails, and every time I get influenced by them, I think, right, I'm gonna go do it myself. I go do it, and inevitably I live with regret. I literally just did the cardinal sin of having shellac nails done over the holiday season, and then instead of soaking them off, which I know full well that is what you're supposed to do, I just peeled and ripped them off myself. I completely damaged my nails, so bring on the months of nail repair. I know, I hate myself for it. Don't get me wrong, some things are completely worth the investment, but when you're talking about something like Botox, this is really something you have to consider. Botox is temporary, so you are going to have to go back to have the treatment done over and over again if you want to maintain the results. At the time of filming, the average cost of Botox in the United States is around $385, but that really varies widely depending on where you live, where you're getting it done, and if you're getting it done by a licensed medical professional, which you should. And most places would be able to give you an estimate of cost based on your needs and what you're looking for in your treatment. When it comes to maintenance, it's important to know that Botox is temporary and it tends to last only 3 to 4 months, sometimes even less. Since the goal of Botox is to reduce the muscle movement, as the Botox starts to wear off, that muscle movement will start to return. And that can actually be seen as a good thing because it's temporary. You can actually test it to see if you like the results, kind of knowing that it's going to wear off eventually if you don't like the result. But also having to go back and back and back can be annoying. I mean, I don't even like going back to get my hair highlighted as often as I do. Don't tell my hairdresser. And of course, there's also the possibility of issues related to Botox use. Although it's rare, there are some cases where people can develop antibodies to Botox which render the Botox ineffective. or just not working as effectively as it used to, requiring more and more product to be able to get the same results. This doesn't apply to everyone, but it could be a possibility for some. The effectiveness of Botox itself does not decrease with repeated use. In fact, it's the opposite. Your muscles are actually sort of being trained to be in a relaxed state over time and with repeated use. A licensed professional would help you determine what timing is right for your particular situation. Also, there's clinical research to support Botox's safety and efficacy, but the problem I have is that there's not a lot of research to support its use over a longer period of time. It's not that there's a strong possibility of really severe and negative results over a long period, years, decades of use. It's just that it hasn't adequately been captured in studies or clinical research, at least to my knowledge. If you know something different, please drop it in the comment section below. But the other issue that makes me pause when it comes to Botox is the idea of muscle atrophy, especially compared to the other muscles in your face that aren't being impacted. If you're keeping those muscles under a constant state of paralysis, I mean, it's just like if I were not to use my arm for 10 years, of course the muscles are going to atrophy in that arm from lack of use. While I understand that muscles aren't permanently impacted by Botox because it does in fact wear off, it's just going back to my original concern about the long-term effects. And really, when it comes to that muscle atrophy, does that have some kind of impact on how we look as our face ages? I guess what I'm trying to say is I'd love to know what the impacts are long-term of use of Botox, but also long-term use of Botox and then at some moment in time wanting to be done with it. What is your face going to look like after that point? And that really, I don't think we see a lot of clinical research on that, giving an idea of what that would look like having used Botox versus what you would have looked like if you hadn't used it. Wishful thinking, I know. If only we had a skincare crystal ball. I'm 47 now, so if I were to start now, when do I stop? Can you give me age 70, age 80, age 90? Who knows? And what will the effects of 40 years of use have on my skin? It's just a bit too big of a question mark for me and feeds right back into that maintenance piece. If it's only going to be temporary, then how do I get the long-term results that I'm looking to achieve? Which leads me into my next point. There's a lot of chatter online on this idea of preventative Botox for your early 20s. Well, we've just established Botox is preventative. So it makes sense that the earlier you start, the earlier you're training your face not to make these repetitive muscle movements, not wrinkling the skin. Voila, smoother skin. But to my knowledge, the FDA has only approved Botox use for medical treatments and conditions, as well as for cosmetic treatments of moderate to severe wrinkles. So the concept of preventative Botox in your 20s doesn't fall under that category. And this is just bringing me back to that same common theme of if the clinical research isn't there about long-term effects, how long are the people who are starting this in their 20s going to be using this for? 30, 40, 50 years? I think we can appreciate the cost, the investment, and the maintenance required for that. All of this aside, my biggest reason for not getting Botox is my fear of the side effects. Some are common, some are rare. While Botox has extensive safety data, you can appreciate that some is just in the hands of the injector. If Botox is placed in the wrong place, it can have the unintended side effect and muscle paralysis, resulting in droopy eyelids, asymmetry, uneven brows, inability to smile. In some cases, it can be temporary, but in other cases, it can last for months and need additional treatment in order to rectify it. Of course, you can always have pain at the injection sites and bruising, but also you could have headaches, blurred or double vision, or even dry eyes. And some of the more serious side effects, I think, warrant some definite consideration. More serious complications could involve breathing difficulties, swallowing difficulty, vision problems, spread of the toxin to other areas that are unintended, and infection. Of course, an allergic reaction is also possible, but considered quite rare. This is why it's really important to discuss the potential risks and benefits, but as well your medical history prior to doing anything like this. Like any other procedure, it's going to help reduce the risk of complications and ensure that your injections give you the best desired outcome. The psychology and the social pressure to get Botox also warrants consideration and reflection as well. I mean, for me, I focus on my skincare products, my skincare devices, my facials, and I draw the line at Botox and facial plastic surgery. Who am I to advise that Botox is going too far or facial plastic surgery is too far? To each their own. I think as long as you are well aware of the considerations, the risks, the benefits, the potential side effects, and you're able to make an informed decision, that's really the best case scenario. Age is a privilege that not all get to enjoy. So embracing our age and our looks as we get to traverse this earth is so very important. I also think it's important for women and men who choose not to have Botox to see reflections of themselves in media as well. And that's what I hope to bring to my small platform in my content creation journey. I would love to hear your thoughts on this video topic. If you've had Botox before and are comfortable sharing your story, I think it's going to help other people in the comments as well as me, or just drop your thoughts on neuromodulators in general. Thanks for watching as always, and I hope you have a fabulous day.